Hello and welcome to this presentation on finding the evidence. This is part 1, formulating a clinical question. My name is Derek Yates and I'm the evidence-based practice tutor for Birmingham Women's and Children's NHS Trust. In this session we're going to look at 3 objectives around the process of formulating clinical questions. Firstly, we'll look at where the question fits into the evidence-based medicine process. We'll look at the difference between the 2 main types of clinical question. And finally, we'll look at how to formulate an answerable clinical question. So, where does the question itself fit into the evidence-based medicine process? It's actually part 1. The question is the base upon which the process sits, and questions should be designed and refined to provide us with a basis on which to provide evidence for patient care or to fill a gap in our knowledge. The next part of the process is the search for literature that may provide answers to our question. Next, we critically appraise the literature to see how methodologically robust the studies our search has identified actually are. And one of the reasons that we do this is to give us the confidence that the research findings themselves are useful. We implement the useful findings from the literature into our practice, providing of course that they're right for our patients. And finally, we evaluate the process and our practice to see if we've got the desired outcomes from the evidence that we've used. We sometimes see this process referred to as the 5 A's. We ask the question, we acquire the evidence by searching the literature, we appraise the identified evidence for its quality and appropriateness, we apply the evidence into our practice, and we assess the evidence. You may find the 5 A's is easier to remember. And what's nice about this diagram is that it shows the patient at the centre of the whole process. Always remember to keep your patient's needs, values and preferences at the centre of evidence-based practice. So why is the question and getting the question right so important? Well, defining our question and making it answerable helps us to focus on the evidence that's relevant to our patient and their needs. A well-written question will suggest a high-yield search strategy, and I'd go as far as to say that a well-designed question virtually writes the search strategy for us. The question can suggest what useful forms answers might take. For example, if we define our question as a question about treatments, then we can see that our search to identify therapy reviews or randomised controlled trials, as these are the best types of evidence to answer therapy questions, methodologically speaking of course. So what are the 2 types of clinical question? Put simply, there are background questions and foreground questions. Background questions are broader and more general and usually consist of 2 parts. The question root, the who, the what, the where, the why or the how. And then an aspect about medicine, for example the disease, disorder, test or treatment that we're interested in. For example, background questions could be what is gastroschisis? Or do vaccines cause autism? And we'll often find answers to these questions in books or guidelines. Foreground questions, on the other hand, ask more specific knowledge that are intended to inform our clinical decision making, and they usually contain 3 or 4 of the following elements. An element about the person, the population, or the problem, or indeed a combination of all 3. An element about the intervention or exposure that we're interested in. In terms of a question about diagnosis, this part of the question would relate to diagnostic tests. An element about a comparison that we're interested in, if necessary, and an element about the outcomes that are of interest to us. You'll obviously recognise here that we are building a PICO question. Example foreground question could be, in children with vesicoureteral reflux, can antibiotic prophylaxis lead to drug-resistant recurrent urinary tract infections? And you'll see that this question contains a population, a problem, an intervention and outcome elements. So when it comes to formulating a clinical question, we need to look at the problem, the scenario, or the knowledge need that we're faced with. Then we use the PICO elements to rephrase this as an answerable clinical question. Remember to keep it concise, keep it clinical, and use appropriate language, and avoid colloquialism. By this I mean to leave your question free of local terminology. And the best example I can think of here is one from maternity care. On the delivery suite at Birmingham Women's Hospital, you'll often hear people talk about the drug syntocinon, which is a form of synthetic oxytocin used for the induction of labour. However, nobody ever calls it that. Pretty much everyone calls it Synton. And a search for the word Synton isn't going to find you what you need in the databases. You'll be lucky if you find anything at all on synthetic oxytocin. Finally, always remember to consider the patient's needs, values and preferences. And remember, only ask one question at a time. By this I mean, for example, if you're interested in dozens of different types of outcome, consider writing a question that is looking for one type of outcome and then write separate questions for the other types of outcome. Or you may want to consider not specifying the outcomes at all. Adding too many terms into a question means we can end up with an unwieldy question that's difficult to search on, and when we do, the search identifies so many answers that we end up having to screen thousands of abstracts, many of which might be irrelevant. On the other hand, an overly complicated search will identify nothing at all, where there may be answers of relevance out there. That's the end of our presentation on questions. Now we have an exercise for you that we'd like you to complete using the worksheet we've provided. We want you to think of a recent patient encounter, preferably one where you might have been unsure of the treatment route you were going to take. If you can't think of one, don't worry, you might have been on nights recently and have the memory of a goldfish due to a lack of sleep, and that's absolutely fine. In which case, just go ahead and make one up, but try not to be too obvious and avoid asking a background question. Now, use the PICO acronym elements to create a 3 or 4 part clinical question. Retain a copy of your question. We'll be asking you to use this question when we come to the searching exercise during our training session. Good luck.